Welcome back, everybody. Thanks for joining us. I'm Dr. Juliet Nevins. It's now June 2021. It's a beautiful summer like day here in New York. We are more than a year past the day that George Floyd was murdered. We've heard a lot about health inequities and disparities brought to our attention by what happened with COVID and how that disease affected predominantly Black and Brown communities. We also heard a lot about Black maternal morbidity and mortality. And we have heard a lot about how Black and Brown women suffer more from serious conditions like preeclampsia, bleeding, and certainly are more likely to die after giving birth than our white counterparts. I bring to you today the faces and voices of Black women. Some have had very hurtful and traumatic experiences. Another had a very positive, wonderful experience as she brought her child into this world. I want us to listen to their stories. I want us to have a face and the sound of their voice to match the statistics that we are reading about over and over again. This is not a problem that will end in 2021. It's not going to end in 2022. So we need to remember, we need to keep working on this issue. And I bring to you real people, real women. Listen, and please send us some feedback. Don't forget to subscribe to the Juliet MD channel because we do want to bring to you more real world stories. Thank you. Thanks for gathering with me after work. I know it's been a long day, and for some of you, the day isn't over yet, right? Um, you all remember me. We did the interview together. We did the sit down. I picked you specifically because your stories were so powerful. And one of my concerns was that I need the stories to go someplace. People need to hear what you went through, how you got past your pain. We want to know about the success stories because we want to share with other mothers how to have a success story. So I'm going to start. And Tangela, are you there?
Yes, I'm here. Good
Oh, welcome. She's hiding, but that's okay. It's all good. So I just wanted for us to convene again and just talk about really what happened. And I'm going to start by having you guys introduce yourself. We're going to talk about our birth stories, and I'm going to be asking you some questions because I really want people to understand what you went through. I want them to learn from your experience so that, what happened to you does not happen to somebody else. And most importantly, I think that this recording needs to be sent to all the OBGYNs, Black and white. They need to know how we feel, how afraid we are when we walk in the door and we're hoping to leave with a healthy baby. We want to know the microaggressions that happen that are so impactful on our lives moving forward. So I'm going to start with Makita. I want you to just introduce yourself, your name, and tell me where you live, and then we'll go on to Soltrice.
Hi, I'm Makita Islets, and I live in upstate New York. I'm currently in Vegas, though, enjoying the weather because upstate New York is still cold.
How upstate are you? I'm in Beacon.
Albany.
Okay, you're skiing to the grocery store. Okay, so you're Thank you for agreeing to come and share again your story. We can't wait to hear it. All right, Tiffany, tell me your name and just where you live.
Hi, my name's Tiffany Woods, and I'm currently in Richmond, Virginia.
Okay, fantastic. And Jillian?
Hi, I am doing the impossible. I'm Jillian Davis. I'm in the Dallas-Fort Worth area, and my daughter is getting baptized on Sunday, and she's in baptism class in the background on Zoom. So I
Oh, my goodness.
apologize. I'm
Okay, no,
sorry.
don't apologize. Listen, did you hear my song? It was Mama by Boys to Men, right? So
Yeah,
this
so
is what
I'm
we
literally
do.
doing like this.
We flex, we flex. We know how to do that.
Oh gosh,
And
this
you
is
guys
funny.
remember
She said
Angela
hi.
Garvin?
Um,
She is just so wonderful, and she's just, helping me to sort of collect your stories. We're going to make sure that these stories are heard, ladies, as far and as deep as we can push it. So we're going to jump right in because I've allotted an hour to talk to you and get your stories. And Makita, if you don't mind, I'd love to start with you. And when Sutrice comes back, we'll have her jump back into the conversation. So I want you just to talk your own words, go through what happened. And I want you to tell me, how many children do you have, and how old is your child or children?
Well, I have 3 children, and my first child, my son, he's 21. My daughter is 17, and the baby is just made 4 on Sunday.
Oh, okay. All right. So did you have a
Um,
traumatic experience with all 3 or just one in particular?
the first one in
Okay.
particular, for the most part, each one, I completely had a different experience.
Okay.
Um, of course, with this last one, as I had mentioned before, I am a labor and delivery nurse. So
Mhm.
I've already known, you know, I kind of did my own labor and delivery, and my best friend is a labor and delivery nurse. So, of course, she was my nurse.
Mhm.
So this last experience was, everything probably every woman should have. But the first one, it didn't start that way. And I think the main reason was because I was a young teen mom and I was a Black. So I was 16 when I got pregnant and 17 when I actually had him.
Mhm.
But I refused to be a statistic. I did not want people to think that this was all that my life was going to be.
And
But
you know
because
what the
that was my
statistics say,
surrounding.
right? You know what the statistics say, right? If you get pregnant 18 or under, your risk of living a life of poverty increases significantly. So that's
Right,
the stat around that number. So keep going.
right. Um, and I seen that. I seen that
Mhm.
around me. My best friend
Mhm.
uh who already had a child
Right.
probably 2 years prior to me. And I seen the way she was treated. So to me, I armed myself with educating myself. I read everything that I could possibly read. I knew what kind of birth story I wanted to have,
Okay.
medications, what they were, what they did. Um, I didn't go to appointments or emergency rooms. I shouldn't say appointments. I went to all my appointments scheduled on time. I didn't go to the emergency room for nonsense or anything like that. I did everything that
Right.
I was supposed to do.
Mhm.
Um, and every appointment I had with the midwife, she was kind of amazed that I knew what I knew, and so she would quiz me when she's talking to me to see if I really understood what she was saying and what the process of going through, the pregnancy was.
Mhm.
And probably midway through the pregnancy or a little after, she stopped quizzing me because she realized that I was really reading and understanding and getting
Right.
all that was going on. Um,
So already
so
you've already sort of proved her wrong in terms of biases that she more than likely walked into the room with.
Correct. I got there, and of course, I was, 5 to 6 centimeters at that point, and his head was low and things like that. And so they was kind of trying to gear me to give birth without any pain medication. I was like, I need some pain medication and I want an epidural, please and thank you.
Mm-hmm.
And they,
now, what do you mean they didn't want to give you an epidural? What go back a couple sentences with that.
yes, they was like, oh, well, you can do it without, you already had more than halfway. And I was like, well, I don't want to do this without it. I don't want to give birth to no baby without an epidural. But it could be all done and over really quickly, kind of like trying to convince me the other way. And I was like,
feel pain. You don't feel pain.
Right.
Right?
Right. Right.
So
and want to put me in the bed and lay me down. And I'm like, no. So
but we're laughing, but let's pause for a second, right? Because, we have studies that have demonstrated that, Black women are offered pain medication less often than white counterparts, even though the pain level is the same. They tend to be poo-pooed, they're encouraged to, deliver without an epidural. This happens, and it's a function of the bias in terms of our pain tolerance. We don't feel pain. So we're giggling now, but that is one major component of the experience on the maternity floor or labor and delivery that Black women go through. So I'm gonna keep going. I want to sort of go more into your story.
So we went over to the delivery room and I pushed for 10 minutes. The attendant came in and he was stressed, and I assume stressed. He was very nasty and rude to me, and he stopped everything. And he was like, you're not pushing good. You're not pushing well. I'm going to use forceps if you keep going like this. And I said, forceps for what? I don't want you to.
How long have you been pushing? How long?
10 minutes.
10 minutes. Okay.
10 minutes. Mm-hmm. So he stopped everything for 5 minutes. He's like, I'm going to use the forceps. I was like, I read about forceps and I don't want to use forceps. And it's only been 10 minutes. What I've read, women can push up to 3 hours on their first baby. And he was like, you're not pushing. And he was like, just very nasty. Mm-hmm. And we started pushing again. So as I'm pushing, the anesthesiologist kind of gets down there and cutting a piece. I knew what she was doing, but I didn't feel any pain. I mean, I felt, something's going on. And so I pushed 15 minutes more. So it was 10 minutes and then a 5-minute break. And then I pushed 15 minutes more and I had the baby. And as the baby is on me, my sister and I hear the anesthesiologist or whoever that provider was say to the medical student, well, I didn't even have to give her an episiotomy, but I wanted you to see it anyway. It's good that you saw it.
So, that is a part of the story that I felt the most poignant, the most consequential, the most impactful. I mean, all of it, is disturbing, right? Them sort of delaying your epidural, not listening to you in terms of what's going on and what's feeling. And I can tell you as a OBGYN, that's not necessarily how we approach patients. Certainly it's not the proper way to approach patients, especially someone who's in pain and they're looking for you for guidance and comfort and care. But doing the procedure on someone, without letting her know what was going on, right? Because there are risks to getting an episiotomy, and doing it to practice, really, it just hurt me. It just hurt me. And I'm going to pause. I want to sort of hear from the other women on the Zoom, because I'd like to know what your reactions are to what Makita just described about her experience.
I have concerns about that because where my OB is located is the main hospital here in Richmond, and it is a medical college. So there are students, but I've had other procedures where I feel like I've signed a form where I did not want the students present because this is not a time for you to practice on me for anything. I want the doctor in here, specialist or whomever to do the procedure. But oftentimes, especially if you're sedated and if you don't have anybody with you, the student's there. So like, what do you do because it's against what you wanted. So like, what do you do to combat that?
Well, there are historical precedent, as you guys know, of inappropriate sterilization of Black and brown women. It is actually happening today, certainly in other countries. It's been on the news recently. Jillian, you're shaking your head, so you're aware of what I'm talking about. If you're going to do a procedure, let them know what's going on. And certainly, the standard of care is that if you haven't signed that consent form, if all the possible procedures that can or be done, while you're under was not explained to you ahead of time, then they can't do that procedure. They're not supposed to do that procedure. Makita, I've heard that story before. It really stuck with me because that should not have happened. And, this is an example of the types of treatment that happens to Black and brown women on L&D. I'm going to pivot to Satrice. So I need you to introduce yourself. Tell me how many children you have, how old they are.
I'm Satrice Collins. I have a 12-year-old daughter who is my oldest, and I have a 10-year-old son. My daughter, when I got pregnant with her, I was 36, I believe. So I was already considered, as I was saying in our last meeting, a geriatric pregnancy because of my age, which was, somewhat alarming to a new pregnant mom. My husband was active duty military. So my birth story takes place at a military hospital. And I was in a unique situation where I also worked for the hospital as an analyst. So I was already collecting data for our providers. So I knew our providers on that side. I didn't really know them personally one-on-one. So when I went into the hospital, I kind of had a different kind of outlook as to how I was looking at my visit in the hospital, because I'm checking the block lists and seeing if they are meeting what we would call a quality standard or whatever. So I worked that day. I had an appointment. Our office was outside of the hospital. I walked across the street to go to the hospital for my appointment, and I had a midwife, and she took my blood pressure, or they took my blood pressure, and my blood pressure was high. At that point, it was like 200 over 103. So it had went
really, really high blood pressure going into L&D, right? Yes, you were healthy, but you were still a first mom, right? And certainly you were older. I wouldn't use the word geriatric, but those two variables alone puts you at risk for developing preeclampsia. So you have the baby, and what I want to get to is what happened after you delivered.
My blood pressure consistently went up. And so they started taking my blood pressure every hour on the hour. Mm-hmm. Then they had an order not to take it with the machine, to take it manually, to make sure they were getting an accurate reading. Eventually, at some point in time, they gave me medicine. And I remember I ended up on 3 different medicines. They gave me 2 medicines, and they said it's still not coming down. They ended up giving me a 3rd medicine. We're going to try a 3rd medicine, and then we're going to discharge you. So after about 4 or 5 days, they were prepared to discharge me, gave me orders to continue to take the 3 medicines, get them refilled. At the military hospital, we could go right downstairs to the pharmacy. So they sent my husband downstairs to get all the refills or get the prescription so that I didn't go home without it. Told me to take the medicine, gave me my discharge paperwork. My husband went down to the pharmacy. I was sitting at the front door of the hospital with a newborn, feeling like not the best, and feeling like I looked like death warmed over, waiting for my husband.
Pressure before you were discharged. Do you remember that number?
I do not remember that number. Whatever it was, they said, okay, with the 3 medicines, it's now better controlled, and they felt comfortable discharging me. And I never had a headache. I never had blurry vision. They kept asking me these questions. They didn't explain to me why they were asking the questions. They didn't explain to me anything that I now see in my medical records was never told. I was never told preeclampsia, eclampsia, was never told anything. They were just coming in and checking my blood pressure.
Right. So we should just stop just so everybody knows what preeclampsia is, right? It is actually about 10% or so of women who are pregnant develop preeclampsia. It basically is when your blood pressure, goes really, really high. It's a disease or a syndrome, I think is a better word, that affects the entire body. Your liver, your eyes, you can have manifestations everywhere, edema, swelling of the legs. But it's really important because if we don't control those blood pressures, you can develop seizures, strokes. If you're still pregnant while your blood pressure is, 200 over whatever number, certainly then you're talking about problems that can then happen to the baby. So she's really sick. So I just want everybody to understand she's really sick. 4 days, 3 medications, they're not bringing the blood pressure down. And it doesn't sound to me that A, your blood pressure was controlled or that you were feeling well enough to go home. And C, you don't know what is going on.
Right. I absolutely didn't know what was going on. And I didn't know until the last call when I went through my medical records to see. I still didn't know. My daughter's 12, So we went home, and that's when I started getting a headache. Mm-hmm. That whole first 24 hours being at home, and I don't know, maybe it's because now I'm expected to perform like a mom, and I'm doing more, whereas in the hospital, I wasn't moving around and doing stuff. But I had this massive headache that just felt like my head was just about to burst. Mm-hmm. And I got ready to go to bed that night, and I sat on the edge of the bed, and I told my husband, I feel like I'm about to die. I feel like if I lay down, I'm going to die. Mm-hmm. And we have a child now and a responsibility to her. So we got up and we went to the emergency room, and they admitted me, and he told them, we just less than 24 hours, my wife was discharged from having a child. They took me back, and because they had the labs from before, they ran some more labs, and they said my liver and kidneys were starting to shut down, and that I needed to get readmitted. They needed to get whatever medicine in me, put an IV in me. I had a lot of fluid. I did have a lot of fluid. I had a lot of fluid. I had gained 67 pounds, and it was all fluid. So they could see that. And I like I said before, one of the nurses asked me, when did I take my rings off? Because she's seen I didn't have my ring on. And I said about 4 months. And she said, that's when you became preeclamptic. That was the first time anybody had gave me any type of semblance of a diagnosis as to what was going on.
So when you were
no one ever said anything to you?
When you were readmitted, at what point did someone sit down by your bedside and explain to you what was happening and explain to you that you were severely ill? Did that ever happen?
Never. That mention of that's when you had preeclampsia was from the intake nurse at the ER. That was the first time anybody had said anything about any type of diagnosis, ever.
And why, Satrice, in your mind, do you think that happened? Why do you think that no one thought to sit down and explain to you what was going on?
I don't know. I think that's a very interesting question. I honestly don't know. The military hospital was also a teaching hospital. I know when I came back to the ER, it was students that were checking on me. I had a student do the catheter, and she messed that up, so there were students that were seeing to me. I don't really recall when I seen an actual doctor when I came back to the ER. Mm-hmm. It was students in and out. I was in the ER for about 5 hours as they were trying to figure out if I should go back to labor and delivery or go to ICU. And eventually they sent me up to ICU. Even in ICU, I spent another 4 or 5 days in ICU. No one in ICU ever said what was wrong, how long I would be there, what could possibly happen. They didn't tell my husband, as far as I know, either. He's at home with a newborn, bringing the newborn into ICU. That's how oblivious we are to anything that's going on. No one's saying anything to us.
So we have something building here, ladies. We have, procedures being done without consent, without explanation. We have a severely ill imam who is a married woman in the military who is still being sort of dismissed because, you know, she has a severe illness that could potentially lead to seizure, stroke, death. She doesn't know what's happening, nor does her husband. I want to pivot because I want to sort of, you know, set the stage for what it should feel like, what it should be like when you're having a baby. So I want to go to Jillian, right? Jillian, I want you to tell us your story, because the theme today is Black birthing, right? Stories of triumph and getting past pain. So Jillian, I would like for you to just share with us your story. You have a daughter, and how old is
I
she?
do. I do have a daughter. She is 6 years old, and that's my only. And she may be the only one. I don't know. But my pregnancy, it actually went well. Um, I didn't I didn't plan her, but she wasn't a surprise. However that works. But she made it. And my doctor was a friend of mine. So I felt like I was treated very well. Um, I don't feel like in hindsight, after talking, that I had a lot of planning around what my birthing would look like. I don't feel like I was very well prepared for the potential of a C-section. More or less, I felt like they did a lot.
You had friends, professionals who you trusted to take
Mhm.
care of you. How did
Yes,
that feel?
it felt fantastic, because I never had a doubt that she didn't have my best interests. Like, we were friends first. So when I got there to have my daughter, which, you know, she didn't come when she was supposed to, so we made the plan, for me to come in, made the appointment. I came in, and things were not going well. They had such a really smooth, everybody was like, oh, we're just going to get you prepared just in case. And, cleaning up the surgical area. We're just going to shave you and get you ready just in case. Meanwhile, chaos was brewing where they were trying to hurry up and make sure they had my space ready for surgery. So, I always joke about, it was like a show on, I can't remember what show it was on, but it was like a 30 or 40-minute show. And I remember being wheeled out at the beginning of the show and being back in my room by the end of the show. They
So,
got
so
that
you
thing
had a
taken care of.
C-section, but
I
they
did have a
protected
C-section, but
you,
they were so calm.
right?
Oh,
Protected
we're
you
just
from
gonna
the
get you
emotional
ready.
trauma.
Yes, not letting me know, hey, your daughter's heart rate keeps dropping every time you get a contraction, which I couldn't feel. They were looking at the monitor, contractions were happening. They hadn't even induced me yet, but I was having contractions and clearly didn't feel a thing. But
Okay.
every time I would have one, it would drop her heart rate down and make the nurse's station um, monitor go off. So they would come scrambling in there, and I'm asleep because I'm sleepy. And they're waking me up like, hey, what's going on? Are you okay? And I'm like, yes, I'm hungry, I'm sleepy. So they're like, okay, something's not right. And went and got my doctor. And before I know it, I'm in the surgery room. So they did a really good job protecting me, but in hindsight, I was not prepared for that.
Right. You were not informed.
I was not informed.
You're not informed. So, certainly there could be challenges with that. But I think, the reason I wanted you here, the reason it's so important to hear your voice is because you never had a doubt, right? That you were going to be cocooned by professionals who were well trained and who saw you as a human being, and they were going to take care of you. And that's what we need. We need people to
Yeah,
listen to us. We need people to communicate to us, and we need people to take us seriously when we are trying to communicate with them.
yeah,
So, on the topic of seeing us as human beings, as women, as mothers, as patients who feel pain, who are scared, and other than our L&D nurse, a lot of people don't have the information about what's supposed to happen, when they go in to have a baby. We're going to go to Tiffany. When did this happen? Like this is we're in 2021. So what month of 2020 are we talking about?
So March 24th, found out I was pregnant. March 28th, I was in the emergency room. 29, March 30th, was turned away from my OB yet again, found a new OB that Thursday, so the beginning of April, went to the appointment, was turned away again, and
So that's 3, right?
Yeah, 3, and had to wait until April 6th. Okay. And my boyfriend was my advocate because he was like, they're not turning me away again. So I really believe that's how I got in there April 6th. But she sent me home. So they did everything you do at your first prenatal visit. And she sent me home with no instructions whatsoever. So I'm like, well, what am I considered high risk? Like, what do I do? What do I prepare for? You know? So we did contact the office and she said that I needed to be on bed rest. I've never heard of anybody.
How many weeks are you at this point? Do you remember?
7 weeks, I want to say.
Okay. Right.
So that didn't make sense to me. I'm like, I know a lot of my friends who have had children, like bed rest, it just doesn't make sense. Yeah. So I did stop bleeding, I remember, on my 8th week. No, we called her back and asked what activities, like if any, you know, can I do? And she said nothing, like nothing at all. So go to bed, wake up, come in my office, work. That's that.
And just so you know, there's no such recommendation to put someone on bed rest in the first trimester when they're having spotting. Just to, you know, put that out there. I think it's important for you to know that what you thought was right, that it didn't make sense, and that is not standard of care.
And now I know that,
but what I wanted to get from your story, what I thought was really important for us to sort of learn was how many times this probably would have happened had it not been COVID, right? Because this is what happens to Black women all the time. No one listens, we get turned away. Did you end up having a miscarriage?
So I did.
Okay.
But it happened. I continued, so the 8th week was fine, but after that, I continued to have the bleeding, but then I started having severe back pain, very severe. And I was told yet again, if you want to go to the emergency room, okay, but we're not bringing you in. Okay. So I decided Mother's Day was entering my 12th week on Mother's Day. Still was pregnant. I did go back to the hospital or to the doctor to have like all the testing done for any conditions and whatnot. Made the announcement on Mother's Day. That Monday after, we were walking and I just felt like from my back to my front, it was pain, you know? And we came home, the bleeding was bright red and it wasn't like that prior. That night, it felt like how the bump the app described contractions would feel. So we called the on-call provider and she said, I already know what's happening. So that morning, we just went through the night. That was 11 o'clock. I will not forget that morning, 7 a.m. We went to the hospital and they did an ultrasound and it confirmed I was having a miscarriage. Had to get a D&C. I literally didn't find out until this past weekend that they could sedate you or whatnot for a D&C. They did not. I felt all of that.
Oh, that's awful.
I felt all of that. And
did not have anesthesia. Wait, go back. Where did they do the D&C? Where was it done? In the operating room?
No. So the clinic that I went to, they actually are a part of a bigger hospital, but they kept me in the clinic and they just didn't let like other patients come in, but they kept me in the clinic. And it was a horrific scene. I think that's why they didn't let other patients come in. It was horrible.
So in March in 2020, we're doing a painful procedure on Black women with no anesthesia, no anesthetic. I mean, that's a little crazy. Is it just me?
That's like, I get, it's still hard. It's still hard just to know, like, no, I don't know if my baby would have, made it or not, but I should not have gone through. I'm not just gonna, I feel like, be compliant because you told me so. That's typically not me, but I felt like that's what I did. I went through blaming myself. And then finally, when everything happened, the OB who, it wasn't a cyst, it was fibroids. There's a difference.
So I just want to stop. And first, I want to thank you for being vulnerable and sharing your story. I want to remind you that the miscarriage was not your fault. All right? I need you to hear that. The miscarriage was not your fault. The miscarriage was not your fault. All right? But your story is really important. The number of people that you had to see, the number of appointments that you had to make, and then it culminates in a procedure where you're feeling the whole thing. So I have to pause. I have to pause for a moment because I'm feeling that.
It just put so much fear in me. Like, I desire to be a mom, but I still pain. I feel like physically I still pain. And it took months for me to recover physically. And then finally, my original OB, who is a high-risk OB, she admitted, she said, we failed you. You think? And it's like, I really don't want to hear that, like, yes, you failed me. You failed me big time, and I'm finding out things, hindsight. I just have no trust for.
So I have to ask you, Tiffany, when they were doing the procedure, what happened? Were you screaming?
Yes.
What did they say? What did they say? Did you ask for pain medication? Like, what was the reason for not giving you anything to help you with the discomfort and sedation? I need to sort of understand.
To be honest, I didn't even know. Like, he just made it like protocol, like, okay, now we have to do a DNC. He went out. I mean, he seemed compassionate and he came back in, they prepped me, and I was screaming. Yes, it was horrific. I sounded like someone, in chronic pain. And he asked why he was doing it. He said, are you screaming because it hurt physically or because of what happened, because of the loss of the baby? Why would you ask me that? Never, not once. And the nurse, she just held my hand and I saw the tears in her eyes.
Tiffany, what do you want to say to the people who failed you? What do you want them to know so that they can potentially change their behavior? How can you teach them through your pain, through your wounds, so that the next person who comes along is treated better? What words do you have?
I would want them to know that I matter and my baby matter. I don't care where I'm at in my pregnancy. This is not only my health, this is my child's health. And just like you would treat my white counterpart, you should treat me the same way. And you should not withhold information from me. If you simply don't know, tell me you don't know. And we're trying to figure it out. Give me all of my options. And I don't know how many times I had to tell them. And I feel like as a Black woman, I'm always having to prove and show how educated and articulate I am. So that way these providers can talk to me at a higher level, like I understand. So just treat me, I don't know what other way to put it, treat me like you would treat my white counterpart, because I do feel if I was a white woman on that table, I would have been offered everything in the world and probably would have been an inpatient afterwards. And then to send me home with nothing, no medication, nothing. We had to go to the pharmacy and I'm just feel like bleeding out to find out like what to do. I got a hold of a nurse. I don't even know who the nurse was to this day, and just asked. Like I explained to her what happened, just asked, like, please just tell me, what can I do? What can I take? Like just the pain. And I feel like I am scarred. Like I've been grieving and still, of course, healing, but they scarred me. I feel like they have left damage in my heart that is just so hard to overlook. I don't trust even my PCP, who I have had a relationship with for over a decade. It's like, I tell her it's not personal, but I just don't trust. And it's to the point now when I go to the doctor, even if it's for an injection, I'm doing my research, I'm an advocate for myself. And if anything, they created not a monster, but I'm a force to be
Someone
reckoned
who is more aware. Someone
Yes.
who's more aware.
Yes.
I'm going to ask you, Sutrice, you had severe preeclampsia. You were in the hospital for 4 or 5 days after your baby was delivered, which speaks to the difficulty they had in bringing your blood pressure down. Had you not been in the house with another adult, your husband, I mean,
There was no plan.
but I have to say it, right? You may not have been, you may not be here today.
Right.
What do you want to say? What can we learn from your experience? We're trying to get pain. So how do we teach? How do we teach? How do we teach the doctors who are taking care of Black and brown women? How do we teach Black and brown women, how to better engage with the healthcare system so that they're safe? What words do you have?
I would say, going back to when I started the swelling, something should have been said, especially, a doctor would know. I didn't know anything about preeclampsia. So the doctor should have been alert and aware to say, it looks like you're developing a condition. My feet were swollen. I used to have to prop my feet up. I worked at a desk. They had to bring me special equipment so that I could just type, So it was evident that something was going on. To someone that knew the signs, I didn't know the signs. But to someone that knew the signs, I would think it was kind of clear what was happening. And I think they should have taken the time to get to know me as a patient, to understand that I traditionally had low blood pressure. I traditionally had like 107/78. So when my blood pressure did start going up, to them it looked normal, because they weren't my normal OBGYN, just based on the rules of the military at that time. I had to come and start using a military OBGYN who wasn't familiar with me. So maybe she should have taken some time to get to know my medical history and understand that when it started going up and it was looking normal to them, that it was high for me as an individual. And that was missed. And then I think once I was admitted, there was never a conversation with me. Maybe they were talking to my husband, I don't know. But there was never a conversation with me to explain what was going on. And I'm an analyst, so I'm one of those people that if you had told me, I would have probably started trying to figure out how I could research it and understand it better. And I think that was what was missing for me, is just I didn't even understand what was going on.
Okay, so they're just adding medications, hanging medications, and you had no clue how sick you were.
And I'm not even a person that takes medication. So for you to send me home and say, here, you're going to be taking these 3 medications with no end date, just come back in 2 weeks and check with your doctor in 2 weeks for your 2-week checkup. When I went to my doctor, I think it was for my 6-week checkup, I told her, I'm getting off this medicine. And she said, well, you're not ready.
Right.
I said, I can't see taking medicine for the rest of my life. They still didn't say, but you had this condition, and this. It was never even explained to me. I just chose to get off the medicine, and I researched it to see how, and I weaned myself off of blood pressure medicine.
Nikita, right? You had to fend for yourself. You had to prove your worth, right? And you still had an episiotomy because someone wanted to practice on you. I mean, how do you feel about that? You were practiced on.
Well, it really hurts, and like all the rest of the women, it still bothers me. And I've wrote many college papers on it because it bothered me so much. And I think that experience chose my career as a labor and delivery nurse, because I am that advocate. I refuse to allow another woman, especially Black woman, be taken advantage of when I'm around, at least, when it's my shift. But there's a lot to say. We all know there's a lot to say, but I think starting just with listening to us, respecting us, our bodies, we're not just like, rats to be experimented on. It's just so hurtful. And I don't even know what to say. Listening to these other women, I'm still hurt. Tiffany's story, I'm like astonished, even though I'm in the labor and delivery rooms all the time, and I see biases, and I, talk to my colleagues and physicians and things like that when I see those kind of things going on. But it's just hearing all these stories, like you said, in 2020, it's still going on.
Yeah.
I mean, my story was 21 years ago, and to know that we think we progressing, but it seemed like we ain't going nowhere.
And I'm really sad that we didn't get to hear Deborah's story. I don't know if you ladies remember, her story was one of tremendous sorrow, in that her baby died, and there was no empathy, there was no compassion. When she was in the emergency room, she was asked, literally, once the baby was pronounced dead, if she was ready for an autopsy, or if she was going to, I just think that is incredibly insensitive and hurtful, and really speaks to the fact that people don't see us as mothers, patients, human beings. And we really need to keep talking about it in an effort to sort of confront the problem and hopefully one day root it out. Jillian, I, like you, I had a great delivery. I was surrounded by my friends. I had one of my friends who's a Black OB, she wanted to take me to the OR because I had previous surgery, so I was at risk for having a problem with an attempt at a vaginal delivery. So, but my pregnancy, the delivery progressed so quickly that she didn't have a chance to wheel me into the operating room. So we had a little giggle over that. But I felt calm, happy. I had no fears. I knew that if something went awry, just like you, that they would take care of it. And this is what I want everybody to feel. Everybody deserves that, to walk in and know that you're safe, your baby's safe, because the people who are there see you, and they're going to do everything that they can to make sure that you leave that hospital healthy and with that baby or babies in your arm. And that's all we want. I don't think that's a lot to ask for.
No, it's not. And doctor, if I may, do
Mhm.
you know that I didn't even really know what truly happened until well after my baby was even here? Like they were like, look, we had to get her here.
Mhm.
And we needed you to be as calm as possible because we knew you didn't want to get cut.
Mhm.
And that was that.
Mhm.
And everybody was just on standby to do it this way.
Mhm.
Period.
Mhm.
Period.
Well, you have that relationship, but you know what we wanted to sort of bring forth tonight was you're one woman. We have 4 others, 5, because we didn't get to hear Deborah's story, whose experience was vastly different, and unfortunately, their experience mirrors the norm for a lot of Black women when they walk into the hospital. So I'm going to end there. I want to know, are there any last minute comments from anyone? Anything that you wanted to talk about that you didn't get a chance to talk about during our time together?
And I just want to thank you for this opportunity. After we met as a collective last time, that really was my first time like openly speaking on my experience and what happened with me. And ever since, and I do think this is just God showing me, like, you know, your story is going to help the next. I have encountered so many women, and without them telling me, I just feel it like, Tiffany, share your story. And then it turns out like it has helped them, you know, help them become an advocate for themselves. I have one of my close friends now, she's due on the 26th of May. And just encouraging her. And so I just really appreciate it. And it helps with the healing to just talk.
It helps to talk about it. Tangi and I, we're going to be working on getting this information out to people. We're pushing this story out because the last time we were together, I just felt like these stories were, you know, getting blown away in the wind. I want people to hear it so that we hear the statistics, we hear the news, you know, Black women are sort of having worse outcomes when they get on the labor floor, but it is a different reality when you put faces to those numbers and to those facts. So again, I want to thank you for coming forward, for your courage, for your vulnerability. I have a song for you. So we're going to end with my song. Let's see if I can get it going. There you go. Can you hear it?
Yeah.
And Tiffany, this is for you too. Just so you know that, right? I always used to tell my patients that it doesn't get real until you bring that baby home. Just the whole journey makes you a mother. Makes you a mother. Because it takes supreme inner strength to go through what you went through and then, you know, to carry on. And the next time I talk to you, I want to hear some good news. And I know that I will. I'm positive. No doubt in my mind. Okay? Ladies, have a wonderful evening.
You too. Thank you so
Thank
much.
you.
God bless you all.
You
God
too.
bless. Thank you. Take care. Bye-bye.
Bye-bye.
That was painful. Thank you for joining me during this conversation with these wonderful women. I'm going to turn my music down. I thought it was important to sort of hear their story. When I heard those stories the first time, I was blown away. Definitely leave comments, and let's keep fighting. Let's keep talking about this because it's important. We need to get it done. Have a good evening.